Webinar seminar. Thank you for inviting me back. And it's also got to send a special shout out to any familiar faces and names on the participant list. I know that we were able to send out an announcement through our PNI and St. John's Health Center Foundation channels. And so I welcome everybody, both near and far. And to those of you who know me already and have seen me, some of this will be repetition, but that's good because they say it takes 7 times of hearing something to learn something new. And it's even harder for me when it's just over Zoom. I love seeing people in person or over Zoom when it's kind of a back and forth. But as Allison mentioned, I'll try to get straight through everything and leave plenty of time at the end for the most fun part, which is kind of ask me anything. Usually, if you ask me about brain health, you'll get a more informed answer. But I do have open evidence and ChatGPT for clinicians open on the side. So I'm kidding. But in any case, so today the topic is near and dear to my heart, preventing cognitive decline and aging. I direct the Brain Health Center. I'm a singleton endowed chair in integrative brain health. And I use that framework to oversee and direct and also function as a research clinician educator here at the Brain Health Center in Santa Monica, California, on the St. John's Health Center campus of Providence. So it's my pleasure. I moved over here about 8 years ago after having completed my training at UCLA Health and Psychiatry. I still do my volunteer work once a month at UCLA, but my full-time job is here at the community hospital, uh, researching and trying to improve upon the outcomes of the patients that I treat, middle-aged and older adults with at risk for and with early to mid or late stages of memory loss due to Alzheimer's and other conditions. So I don't have any conflicts of interest in relation to this topic and program, but I will discuss the research and off-label use of drugs, supplements, medications, treatments, and lifestyle in older adults, both for dementia primary prevention and then also for care of memory loss at all its stages, which we'll go through in a minute. So again, the broader context, I'm here at Pacific Neuroscience Institute. I believe there's now 35 of us faculty, full-time faculty members. There's a number of other part-time affiliated, associated, collaborative faculty members who are on our full website, which is at pacificneuro.org. And we run the gamut across all the neurosciences. The Institute was founded by Doctors Kelly, Griffiths, and Krause, along with Dr. Kasari, who's not working at PNI any longer, but now Dr. Barkadarian has joined the PNI executive leadership team. They oversee our efforts within the centers of excellence, of which the Brain Health Center is considered essentially an umbrella center or service line, given that all neuroscience patients have to some degree brain health needs, both at the time of their presentation and then ongoing during their care. Here at the Brain Health Center, we do primarily deal in the neurodegenerative disorders. And as you could see from the slide back in even 2024, I had asked ChatGPT, give me estimates of how many of these cases there are, both now and in the future. ChatGPT was very confident on the numbers all the way down to number of current and future cases of things like not just Alzheimer's, but also Parkinson's, ALS, Huntington's, and multiple sclerosis. It did give me the caveat at the time, these estimates might vary based on advances in treatment and prevention strategies, which is essentially the thrust of what I deal in. The thrust of my work is trying to help prevent onset of cases of neurodegeneration, and then also try to slow the progression of cases once disease is established. It's a lot more straightforward to prevent. An ounce of prevention remains worth a pound of cure. It's much more difficult when we talk about getting into reversals and or even things like as ambitious as cures. But as you can see, back in 2024, ChatGPT wasn't hallucinating. I think it was more or less on point. But now, fast forward to last night, I asked the question again to ChatGPT for clinicians, which is a free service, but it's not included in their training. It is essentially HIPAA compliant, though this was not about any PHI, and I do my darndest to never put any PHI into AI. Um, you can see that the advancement of the AI has become quite a bit more nuanced. It actually cited 10 different peer-reviewed publications in the estimates, and it actually conceded the fact that there are not reliable estimates globally for things like ALS, Huntington's, thankfully, due to how rare they are, relatively speaking, compared to something like Alzheimer's or Parkinson's. We are sort of in an era where Parkinson's is a bit of an epidemic globally. The numbers are rising rapidly. For Alzheimer's, the numbers seem to have stabilized a bit, which may be in part due to efforts by ourselves and others in terms of primary, secondary prevention. But even so, the numbers are projected to increase from about 55 million currently up to upwards of 150 million plus by 2050, which gives me pause. Whew. Can I take a breath? Um, this, by the way, the whole talk will be posted online. Allison, I gave her a copy of the PDF with the slides. So if you reach out to Cognitive Care Solutions, or if you manage to reach me or my office, which throughout the talk there are ways to get in touch with us, I'm happy to share this information in PDF format and or recorded video. The whole point of today is a free dissemination of information to get you excited, to get you engaged about improving your lifespan a little bit, and then hopefully greatly improving your health span as an individual. So, what's in it for you? I'm inviting you to take charge of your own lifespan to work on optimizing your health so you can increase your health span. Then that includes, most importantly for me, what I like to call the brain health span. So Alzheimer's prevention is a good example of how we apply healthy lifestyle and precision medicine towards extending not only your lifespan by a little bit, spoiler alert, as far as I know, we're all still going to die. A little bit of lifespan, a lot of health span expansion where we're compressing morbidity, which is in the red below, instead of having a long time of age-related disease, the so-called languishing last decade of life. If we push that into a few days or weeks or minutes, that's optimal. And Alzheimer's is the big A. In my clinic and older adult care, geriatrics, so to speak, Alzheimer's, it's the scarlet A, it's the biggest fear, being alive in body, but not being alive in mind. So how do we improve not only life and health span, but brain span as well, so that we can not go through this turquoise to orange to various phases of purple color? How can we stay in the green zone, or in this case, in the blue zone, to where we achieve optimal longevity? I've been, publishing on this, working on this since at least 2011. They just had brain health was the American Psychiatric Association theme for the meeting last year, and I was like, congratulations, welcome to 2011, here in 2026, 2025. So it's really catching on, this idea that what we do makes a difference, our behaviors matter, and it's based on there being just more and more research. For example, our local group, we had Providence funded P&I Brain Health Center research showing that adhering to a lower carbohydrate diet actually results in greater brain thickness, especially in the frontal lobes, in the frontal cortex, the so-called CEO of the brain, where we make decisions, planning, trying to figure out what to do in the future, what to say when the next slide shows up. I had some nuts for lunch, so lower carbohydrate. Hopefully that means I'll give a little bit better talk for you right now. But enough about that. So this is not work that I'm doing alone. Science is a team sport. We have about a a dozen or more scientists here at Brain Health, including Dr. Brayman, Dr. Maysami. We had help in the past from Emily Popa, who's moved on from us, and then also Dr. Siddharth, who's still with us, working as a collaborative consultant. They did advanced analyses, wrote up, and we all published together in the Journal of Alzheimer's Disease how lowering the carbohydrate load in your diet is associated with the greater brain thickness. That's just a little sampling of the literally thousands to tens of thousands of studies, not done only by us, but by others as well, showing that lifestyle and precision medicine end up bending the curve or moving the needle, so to speak, in relation to how our brains age and how our cognition changes as we become older, even in the presence of Alzheimer's disease. So here I'm highlighting a 6-month multimodal protocol that was published on by Dr. Heather Sanderson, who's a collaborative consultant based out of Solseri Clinic in Encinitas, California. She published a book, very ambitious, called Reversing Alzheimer's. It was based on the Bredesen protocol. Prior to that book, what inspired the book actually was this small clinic-based case series clinical trial where her patients had 4 clinic visits with the functional medicine provider, followed by weekly calls from health coaches to optimize the health, emphasizing lifestyle changes in the context of nutraceutical supports and medications, trying to not only cut back on carbohydrate loads, but even get into mild nutritional ketosis. So ketone bodies as the 4th source of fuel or a 4th energy source that is used not only by muscles, but also by brains. And it turns out that the dementing brain or the Alzheimer's brain is particularly ready and able to use ketones as an energy source, whereas it struggles a bit using sugar or glucose, which is what we tend to use kind of at our default when we're younger in our modern Western diet. In any case, this study was one of the first to demonstrate that you can not only stabilize individuals, you can actually improve their cognitive performance here measured by, it's a course screening tool, the MoCA, Montreal Cognitive Assessment, but she showed that scores were improved from, on average, 19.6 to 21.7 after the intervention. If you want more information about what Dr. Sanderson is up to and the sort of services she's offering, you can find that at marama@home.com. Worth checking out. So I'm not a naturopath. I'm also not licensed as a functional medicine provider, though I have a chair in integrative brain health. What I try to do is, as Allison, you alluded to, is something called precision holistics, which is really putting together the best, or what I hope is the best, of clinical health optimization and lifestyle services. These are currently not covered by things like traditional health insurance, although there is an initiative right now from our government to fund trials, and we put in an application to try to get research funding to cover the cost of delivering some of these precision brain health educational services so they can become covered by standard insurance, so everybody gets this level of personalization. But currently, as many of you experience and know, a 10 to 15-minute clinic visit every few months or so is not enough time and energy for a clinician and a identified patient, client, family to really go to this depth, to this level of personalized exploration. So there's doing this with someone like me directly. There's doing this on direct-to-consumer platforms like Apollo Health. There's also something called Function Health, which is run on the internet as well as direct-to-consumer. Full disclosure, I subscribe to Function Health. I do their labs every 6 to 12 months. They're signed off by a doctor. It gives an AI report of saying like, hey, David, like this is great. This is not so great. Why don't you consider changing your behaviors? Take this information to your doctor if you need help even more than we can offer. And so more and more, there's an invitation for you to become the CEO of your health. And so that's basically what I try to do with people in clinic day in, day out in our research studies protocols, which I'll go over in a few minutes here, some of our research findings from a pilot clinical trial that, again, was funded by not only Providence, but also by generous donors to St. John's Health Center Foundation at PNI. And we're able to demonstrate the brain effects of this health optimization and lifestyle improvement services in the clinic in real life. So if there's one slide I want you to kind of take a screenshot of or come back to, it's probably this one. What is the process of precision brain health? It's personalized brain health planning based on currently available clinical data. So every 6 to 12 months, I get 20 or more labs from people, and then I try to optimize all the factors that might be driving worsening of brain health. So the hidden or potential hidden drivers of dementing illness, Dr. Dale Bredesen in his seminal work, The End of Alzheimer's, identified 36 or more factors like holes in a roof. If you have 36 holes in the roof, the only way you're going to stay dry is if you patch up enough of the holes, hopefully all 36 holes, to where there's no more any rain getting in. Now, it can be hard to find all the factors and fix them all. So we do the best we can, and it has to be iterative. This is not a simple process. It's not a 10, 15-minute appointment for one time. It's not a silver bullet. Some people call it silver buckshot, but even that somewhat minimizes the level of effort. This really becomes a part-time, if not a full-time job for you, the individual, because while there is lab-based things and which can relate to prescriptions or supplements with things like hormone replacement or supplements for metabolism or inflammation or medications, drugs for oxidative stress, there are a lot of systemic changes that really rely on you modifying your lifestyle. And so it's the old take the horse to water, but can you make it drink? We really see the cases improve where individuals are able to have that frontal lobe self-awareness. So it's devastating that some forms of early Alzheimer's rob somebody of self-awareness because behavior change is such a key part of how to stabilize and sometimes even get better, involving things like improving your sleep, changing your diet and nutrition, managing your stress. Sometimes losing self-awareness means you're not stressed about it, but you're loving your care partners, like suddenly at risk of dementia themselves, which is a study. They've done that. Care partners are at risk for Alzheimer's, for heart attacks, all sorts of things, because obviously devastating to watch somebody getting worse when they no longer have the capacity to like make the changes themselves. So in any case, in those scenarios, we just do the best we can. So don't let perfect be the enemy of good enough or good. So this is the framework that I take in clinic, that others are taking across the country. Thought leaders like Dr. Gary Small, Dr. Dale Bredesen, Dr. Richard Isaacson, who you may have seen on CNN or otherwise, Dr. John Hodis, who's one of the young up and coming neurologists of the future, who will be applying these things not only at this simple way that I'm doing, but even more nuanced, even more complex with the immune system and other gastrointestinal system, modulation of our immune response to health stressors and pathogens that we're only starting to learn about and scratch the surface on that, thanks in part to young doctors like Dr. Hodis. So, but today and tomorrow here at the clinic, we are doing things with lifestyle. Here's an example of what we call fit brain or dual tasking. Again, it's led by a fitness trainer, not by a licensed clinician, so it's not covered by insurance, but it is meant to be affordable, like paying for a Pilates class or a yoga class, or maybe we do have some scholarships available. Again, thanks to grateful donors and patients, we have programs set up for scholarships. The goal is to get people in and to get people active. We have both individual services where people are doing cognitive training while they exercise. We do this with individuals. We do this in small groups. We do this in person. We also have some offerings virtually. And increasingly, there's an evidence base for this, including our team just published, I don't have reference for it pulled up, but our team just published the positive effects of this fit brain type approach at a residential care facility for the elderly, aka an assisted living. So that'll be in the update talk next year. And that was led by soon to be the future Dr. Ryan Glatt, who's actually currently working full time with us and also working towards a PhD in cognitive neuroscience. So way to go, Ryan. In any case, there's our local work, there's work of our direct collaborators, there's the work of people in the area of functional medicine and saying like, hey, we can make a difference. There's something you can do. There's always something you can do. Even more important, there are people who have no idea who I am, who are complete skeptics about functional medicine. They're completely naysayers about naturopathy. They do not believe in supplements. They do not believe, which is fine. Those individuals are now telling us that dementia is preventable, that you can intervene and improve care through modifiable risk factors. Thank heavens. So the mainstream scientific community formed a Lancet Journal commission. It's a standing commission, and they've been coming out with reports every few years, starting in 2017, identifying modifiable risks for development of dementia, where you can actually attribute 7% of new onset dementia cases, you can attribute 7% of those cases happened because somebody had untreated hearing loss. What was that? Come again? So I'll say it again. So upwards of 7% of dementia cases happen because somebody has ongoing hearing loss that they're not able to get fixed. Now, sometimes people have hearing loss that they can't fix. It's not always, more often than not, it's nobody's fault that you end up with dementia. There's genetic loading. There's the hazard of a life well lived, of things like head injuries from going on a beautiful nature hike, from, you name it. It's like life is a hazard, right? So there are both non-modifiable genetics at this point, your age, non-modifiable, and then modifiable risks. And over the years, even mainstream science, mainstream medicine is taking note through repeated, both government funded, donor funded, foundation funded, published peer reviewed studies that as far back as 2017, there was like, wow, there's 9 factors. We could prevent up to 35% of dementia cases if you addressed all 9 of those factors. As of 24, we were up to 14 factors and being able to prevent upwards of half of all dementia cases, including cases in individuals with genetic risk, so-called the ApoE4 genotype, which ApoE44, only 2% of the population has that. It was thought until recently that that was basically determinative. If you're ApoE44, you're going to end up with a full-blown dementia. Not so fast. Modify all of these factors, start addressing inflammations, nutrients, hormones, getting toxins out of your body. We are seeing individuals, it's the rare case, but it's happening, where people with ApoE44 are living into their 70s, 80s, 90s without end-stage dementia, without even reaching full-blown dementia. Yes, they're having subjective memory changes. They may be having mild cognitive impairment, mild dementia. But the point is, the more of these factors that you address, the better quality of life you can have in the present moment. So it's never too early to start. It's never too late to do something more. Question I get asked all the time is like, well, what's the evidence for this? It's literally decades of work. This started long before I was an adult or even alive. Thousands of studies. I alluded to me and Dr. Small publishing together on this in 2011. We had, I must say, an impressive number of 72 references. Now the commission updated in 2024, almost 600 peer-reviewed, hardcore scientific references, which lead me to my own quote: if healthy lifestyle were a drug, we'd prescribe it to every patient. This is evidence-based. To me, it's just not a question of whether or not these things make a difference. St. John's Health Center Foundation, which raises money on behalf of P&I's foundation, donor-funded research is now cited and also award-winning. I didn't even have a chance to add the award-winning part. We won the Alzheimer's Award for research in 2025 based on our report that exercise-related physical activity is associated with bigger brain volumes. And we looked at a massive sample of national, international sample across multiple sites of over 10,000 adults. An analysis of the MRIs from these participants, volunteers, found that those exercising moderately for even just 25 minutes a week have bigger brains. And that's from age 18 all the way up to 97. Granted, these are individuals cognitively normal, but movement makes a difference. Movement, even 25 minutes or more a week, associates with larger brains. And you can do that through walking, swimming, cycling. This was notable enough, it's picked up by newspapers across the country. Gretchen Reynolds, a wonderful health journalist for years and years, previously with the Times and here now with the Post, reporting on our findings and us being cited in the Lancet Commission Review from little old St. John's here in Santa Monica, California, based again, thanks to the generous support of our donors, such as the Singletons and others. In any case, exercise is one of the midlife modifiable risk factors, physical inactivity, I should say, really remarkably only like a 2% attributable risk, but every little bit counts because doing something like physical exercise can also help with mood. So you see that depression also itself has a 3% attributable risk. So if you address one thing, for example, trying to address obesity, 1% attributable risk for dementia, but that also starts to help diabetes with 2% attributable risk, hypertension, another 2%, LDL cholesterol, that's a big one, 7%, because of how that ties to heart disease. So we see how there's a snowball effect in a good way. It's probably, I should use some other term other than snowball, but whether it's through lifestyle, modification of dietary habits, supplemental use, things like berberine, or, I always pause before I say anything because I say it, all of a sudden there's a spike in sales for berberine. It's like, no, that's not the point. Metformin has been looked at for a long time. Now there's this craze about the GLP-1 agonists. Can those be used not only for things like diabetes, overweight, obesity, but can they change outcomes in terms of heart disease risk, heart attacks, strokes, Alzheimer's? There's just a big trial that failed for GLP-1s, but it's always a question of like, well, who were the subjects? Was it personalized? Was it individuals? They were really trying to lower central nervous system inflammation in all comers, but is that really going to work? If some patients, one person with Alzheimer's, if you know one person with Alzheimer's, you know one person with Alzheimer's. They may be enrolling patients where they don't have that problem. So giving them that intervention is not going to help. They may have some other intervention. So anyways, I digress. Dementia prevention, intervention, and care. There's also later life risks. A little bit surprising to me, social isolation can be upwards of 5%. So something like today, even just a Zoom, I hope that you're able to talk to those around you about this Zoom video that you're watching, either live or recorded, as a way to connect to other human beings. That connection, that helps your brain be active. Your brain cells that fire together, they stay wired together, they stay alive. So again, it's never too late to improve your brain health. Staying social, using air filters, 3% attributable risk. Vision correction, one of the newer risk factors modifiable identified in just 2024. There's medical services for vision correction at Costco, at, I don't want to date myself, but, places like Lens Crafters or other places. There's really, we don't let people walk around blind. We know that we need to correct our vision. We're a lot more tolerant of letting people walk around deaf, which might be why 7% of cases were attributable to hearing loss, but it's not a competition for the senses. We want to get all the senses optimized to the extent possible, including vision correction. Our team at PNI, we do have vision services through neuro-ophthalmology, neuro-optometry. If you call, really the thing to do is just to ask to see the eye clinicians. You don't have to get all fancy with these tongue twister words like neuro-ophthalmology or neuro-optometry or occupational therapy and rehab. Just say, can I see the eye doctors? It's a medical benefit, is covered by insurance. Another way to get insurance covered rehabilitation services is through clinical cognitive therapy referrals. That's a medical benefit. You can have your primary care doctor or a specialist doctor refer you to our speech and language pathology specialists at Providence, St. John's, and also Little Company Mary in Torrance. I put the phone numbers there on the screen. This is also findable pacificneuro.org on our website. So this is insurance-based cognitive speech therapy with an SLP who helps evaluate and treat changes in memory, attention, organization, communication, word finding, thought organization through cognitive exercises, education, and practical compensation strategies that support your continued independence and daily function, even in the context of the beginnings of Alzheimer's. So part of why I bring this up, we have wonderful practitioners, Annika, Katrine, Romina. They're waiting for your call. They have availability. There may be a little bit of a wait time, but well worth it. They're enthusiastic. They're excited to see you and help you. This, again, this is a medical benefit for cognitive therapies. If you're looking for more of a psychologically framed support that is, again, hopefully your insurance is able to cover this, an original Medicare plan, for example, a group like Cognitive Care Solutions. Allison Layrick is the president of that. The phone number is up there. You can call that to learn more. This is a way to start receiving psychotherapy for anxiety and depression about memory change. And while you're addressing your mood, your anxiety levels, you can also learn some of the brain lifestyle techniques and brain memory strategies as you go through your sessions. This is sort of like the best in the 2-for-1 special. And this is a mental health benefit as opposed to the SLPs where it's a medical benefit. But now I'm just getting into the weeds of like how healthcare works or doesn't work. What I'd like to do is spend the next 10 minutes going over how risk reduction results in measurable biologic signals. So we now know modifiable risk factors associate with the trajectory of dementias. Multi-domain interventions, kind of kitchen sink, doing more than one thing at once, they actually showed mixed effects in large trials. Key questions. Do these interventions or what biologic effects emerge when patients engage in these multimodal interventions? Can we show what mechanism or what's the brain effect? Can we clarify whether or not core Alzheimer's vulnerable systems are being engaged when you do fit brain training and you combine that with exercise training? Yes, you're going to get a recording afterwards. So, okay, so whether or not there's core disease relevant systems being engaged as you do these multi-domain lifestyle precision brain health optimization protocols. We did a study. It was funded by Providence, primarily also by our grateful patient donors through St. John's Foundation and P&I Foundation. It's called the Alzheimer's Prevention Trial. There's a total of 61 patients who all had amyloid positivity, either through a brain scan or blood tests. We randomized patients we gave everybody the information. It's called common sense, but I'm joking. But we gave them very detailed instructions on how to improve their brain health. Then there was a lower intensity, kind of do it yourself, like you can do this, go for it, versus a structured, coached, multimodal intervention. It was 12 months long, and we were measuring cognition, metabolism, neuroimaging endpoints. It honestly was not powered to be a definitive efficacy study. That would cost $30 million. We had more like a $3 million study budget, all told. And so we were really more powered to look biologically what's happening if you start with this framework. So you tailor a recommendation based on somebody's existing clinic data, and then you give them all these domains of nutrition, exercise, cog stimulation, sleep, stress, nutritional, both dietary supplementation as well. And you basically either support this fully by coaching and structured guidance in classes, or you say, you know what, here's all your information, go for it, come back in a year, we'll see how you did. Well, why do this? Early in Alzheimer's, we know that there is change in the vasculature, the metabolism, and the synapses or the connections between brain cells over time. Things get worse. A memory center called the hippocampus, and then also another area of the brain called posterior cingulus, are very vulnerable early on in Alzheimer's. So here's a drawing of what's called the CA1 region, which is a critical region of the brain in memory formation, forming new memories. And we also looked at blood flow as a way to connect the blood flow to the metabolism that's happening in the brain, and how does that impact the structural integrity of the memory centers of the brain. What we found was that the right hippocampus in particular our intervention resulted in preservation of perfusion or blood flow in that memory area, as opposed to in the control arm, the lower intensity arm. So more intense intervention, better preservation of perfusion. This wasn't a primary endpoint, but it was something that we found, and it's already published on. It was a mid-trial publication. We also published on keeping the hippocampus, the CA1 subregion of this hippocampus, stable, and that was associated with better episodic or new memory with our study subjects. Those who were able to better adhere to our recommendations were associated with greater insulin sensitivity. That means like better able to metabolize and use blood sugar when that's a source of fuel. And these findings are consistent with biologic engagement of systems that degrade in Alzheimer's. Now, was this a significant quote unquote efficacy trial? It did not reach its primary endpoint. However, I will say that the control arm over a year got significantly worse, whereas our full intervention with structured coaching, classes, and medical management did not get worse over the year in terms of the statistical difference. They were a little bit lower on their MoCA, which we talked about before. There was an absolute difference of about 1.2 points on the fully supported arm versus the control information only, do it yourself. The between group comparison came close, but no cigar. To have statistical significance, you need the p-value to be less than 0.05, meaning less than 1 in 20% chance that this would be chance. For us, it was about a 17% chance that this might have just been random. So we're not trying to overstate the claims here, but you do notice that the control arm got worse over the year. And this is interesting for us to note when combined with the biologic brain effects we're showing from our imaging studies. A secondary analysis, which is yet unpublished but being processed, is that those who are able to adhere by whatever means, whether it's themselves, their care partner, they went out and they hired their own health coach. It's amazing what some of the control arm participants did. They basically recreated our study on their own, which it is a free country, so that's great. People who are able to do more, adhere more, they stayed stone cold the same. They did not get worse over the year. So higher adherence, no change over the year. Lower adherence, again, nobody's fault, just the reality that some forms of Alzheimer's, you lose self-awareness. Some people are further along. That's another exploratory analysis. Does this get harder to do the further you get into the process? We think so, but it's never too late to make a difference. So the magnitude of this divergence being that those who could adhere better stayed stable, those who had struggled with doing everything that we said to do, which again is not only a part-time job, it's about a full-time job. If you add in all the things that the Bredesen protocol, what Dr. Sanderson recommends, even what Dr. Merrill recommends, you're looking at 6 to 8 hours of effort most days, because you're looking at eating windows, you're looking at food composition, you're looking at getting yourself to sleep, not being stressed about it, but staying social and exercising, all while you get regular lab checks done and you go to your doctor a day, as each one keeps your organs optimal. So is the primary barrier not whether or not the kitchen sink works? You know, we kind of know that when you throw everything at a problem, multimodal interventions that engages disease relevant systems, it can be helpful. People can do better. So is that really the question at this point? I would argue not. So I think any arguments about, oh, this doctor and that protocol doesn't work, it doesn't work. I mean, fair enough. I think there's questions of equity and access and democratization of being able to get the services you need to be able to support your behavior change and your health optimization. But for me, the central question is, can we do this in a way with each other, for ourselves, where we can sustain an adherence at a sufficient intensity over time to stabilize not just our brains, but our whole body. So we don't end up with advanced dementia, we don't end up with a heart attack or stroke, we don't end up with terminal cancers, we don't end up with severe insulin-dependent diabetes. And again, it's a hazard of living. It's nobody's fault. Illness is part of life and death. But there's a lot of resources, both within our group and others, to where you can really start to lean into this wherever you're at and try to figure out a way to make positive changes in your own life, your loved one's life, to where you're able to sustain things in a way that makes a difference. So, summing up, we had exploratory signals across different domains of brain perfusion, that's blood flow, brain structure, that's volumetrics, metabolic insulin sensitivity, and cognitive trajectories. All that were kind of pointing in the same direction is that when people are able to adhere to this type of multimodal intervention, there is, in fact, engagement and correction of disease-relevant systems in early phase Alzheimer's disease. Remember, all the participants in our study had biological Alzheimer's by amyloid PET scan, by blood tests for amyloid, tau. So this was not just people who were worried about it, but we didn't know. These are people with the beginnings of Alzheimer's. The natural history is that this gets worse over time. And we're able to see in multiple subjects in multiple ways in individual cases, people completely stabilized, at least over the study year. And now in clinic, we're seeing this again and again, that sometimes people are able to continue to stay stable year over year. It's been over a decade since Dr. Bredesen published his first book. His first survivors of Alzheimer's, some have been stable for over a decade. There's more about that on his channels or his sites. For me, I have similar experiences in clinic. Though I do say working as a geriatrician, aging is no joke. As we become older, myself included, our abilities change, our capabilities change. So there is a lot of need for acceptance of change with life and with aging. But sustaining your adherence is something that can be done and it makes a difference. But it requires structured support. For each of us, we need to figure out what is not quite right with our health. We need to prioritize the intervention targets as an individual. It's not one size fits all. It's what do you need help with? We need to sequence introducing these things. You can't say, oh, here's your 25-point plan. Like, thanks for coming in. It has to be, oh, this week, let's do one or two things. Come back in a month. How'd that go? Let's do one or two more. So you need this reciprocal. People talk about AI, where it's going to replace relationships. Maybe if your bot can do that iteratively with you, you might stand a chance. But there's so much human element of forming a relationship with someone you care about and they care about you to be able to iteratively have ongoing accountability and feedback that's accurate and supportive and kind of doesn't go off the rails, hallucinating, whatnot. How do we integrate this into the health system is a big challenge. And how do we adjust for the cognitive abilities of the individual, caregiver savviness? Not everybody's blessed having a spouse who's a double major in biology and psychology and studied neuroscience and did psychiatry and geriatric psychiatry and, as a clinician. But even then,
no kidding.
some people like that still have trouble, family members with trouble with memory. Anyways, implementation may be the primary bottleneck in this case. So take-home message. Early Alzheimer's may, in fact, remain modifiable. Multimodal engagement does converge onto biologically relevant systems that get modified through these interventions. The magnitude may depend on sustained adherence, and implementation support may be as important as the way that you design the intervention. So that's the end of my prepared comments. Luckily, we do have some time for questions, and I put up here where I'm working. There's our general website. There's a QR code if you'd like to receive some more information. No pressure. You don't have to do that. Also, if you just go on our general website, there's ways that you can plug and say, hey, I heard Dr. Merrill talk. Can you guys give me more guided direction towards what he does or what's going on? And that's my talk.